So first we're going to talk about a normal peripheral blood smear. So this is a normal peripheral blood smear with normal red cell indices, normal white cell count, and we're just going to use this as a reference moving forward. And so here out at the feathered edge, you can see lots of white cells captured in the feathered edge. And at the back of the smear, you can see where the original drop of blood was placed and then smeared along the slide. So if we go a little bit closer at 10x, we get a little bit higher power view of these different areas of the peripheral blood smear. So again, out here at the very edge, we have the feathered edge, and that's so called because of the way it feathers. And this is where a lot of white cells will accumulate. And so a quick glance at the feathered edge can give you a sense of how many and what the differentials are for the white cells on the peripheral blood. And so this is also a good place to look for blasts if you're concerned about a leukemic picture or a leukoerythroblastic picture. And so we do a quick scan of the feathered edge just to make sure we don't miss anything. Some other things that can happen out here is larger organisms, like even worms can be seen at the feathered edge, tumor cells, carcinoma cells, neuroblastoma cells. So it's always good to look at the feathered edge just to make sure you're not missing something. And then if we move exactly one field in, we find our zone of holes, and so called because of the way that it looks, with all of these kind of holes created by the red cells not accumulating homogeneously. And then one more 10x field in, we find our zone of morphology. And just so that we're complete, one more field in is where our zone of rouleau begins. And so here we can see the red cells are starting to stack up on one another. And so this is in our zone of rouleau. And we'll talk about rouleau in a different video. So let's start again at the feathered edge. We move one field in to our zone of holes, and then one more field in to our zone of morphology. And so at 10x, you can do a white cell estimate by counting all of the white cells that you see in a field. And then you can count a couple fields and take an average. And you take that white cell count and you divide it by 4, and that will give you the conventional number of white cells. Let's take a moment just to look at how the red cells are spaced out and appropriately sized. They all look uniform. They look like their neighbors. There is a little white space in between each of the red cells, but it's not mostly white or it's not mostly red cells. This is kind of the normal red cell distribution in the zone of morphology. So after you've looked at your feathered edge and the back of the smear and along the sides of the smear at a low power, you move into the zone of morphology just to get a kind of sense of what's going on. And so this is your first accurate representation of the white cell count and white cell differential. And if we go a little bit higher at 50x on oil, we can start looking at the white cell morphology. So here we see a neutrophil here and an eosinophil here. And so at 50x, it's a good idea to just scan around and make sure you're not seeing any abnormal morphology of the white cells. I like to familiarize myself with each patient's white cells before I start my differential count, because everybody makes their cells a little bit differently. And so it's always a good idea to get in the habit of finding out what this patient's monocytes look like and what this patient's lymphocytes look like, just so that when you do run across an abnormal cell, you know that it's abnormal for that patient. So after you've scanned around and evaluated kind of at a glance the morphology of the white cells, and you've determined that there's not really truly abnormal cells that you're seeing on original scan, after you do your differential count, you'll want to evaluate the red cell morphology. So red cell morphology is best evaluated at 100x under oil. So here we can see even further detail on the white cells. If you'd like to scan around at 100x to evaluate white cell morphology, that would be fine. However, I find that 50x is enough to evaluate normal white cell morphology. So here at 100x, we have the opportunity to look more closely at our red cells and at our platelets. And so here again, we see in the zonal morphology, our red cells are appropriately spaced apart. They're not stacking up on one another. And we can see that the platelets are also distributed across the smear. And here, unfortunately, there are quite a few platelet clumps. So this may actually introduce a low platelet count in the automated CBC and platelet count. And as we move towards the feathered edge, you can see that the central pallor for the red cells starts to disappear more and more. And so you can be confused if you're a little bit too close to the feathered edge that this might represent spherocytes. And so I just wanted to caution you to make sure that you know where you are in the smear as soon as you start looking at the red cell morphology. And so on the converse side of things, if you go too far into the zone of Rouleau, you also lose your definitive red cell morphology as you have a lot of overlapping red cells. And so right here in the sweet spot in the middle of the zonal morphology is the best place to evaluate red cell morphology and platelet morphology. There is a good way to estimate platelet count, which is to do a count at 100x, and you do that for a few different areas, and unfortunately it's not going to work that well for this smear. But then you take that number, the average number of platelets per 100x fields, and you multiply the number by 20. So at 100x, this is where you're going to be able to identify the different poikilocytoses, to identify any red cell inclusions, such as parasites or Howell Jolly bodies. 100x is also a good place for you to identify intracytoplasmic inclusions in the white cells. And you're going to want to look around in 10 or so fields and just get a sense, is there increased poikilocytosis? Are you seeing increased atypical appearing red cells? Are there Burr cells? Are there spur cells? Are there target shaped cells? So some areas on the smear will show artificial changes, and so you want to make sure that not all the poikilocytosis that you're seeing is just in one field. Like here we see that there are some target-shaped red cells, but that's the only area that I've seen with target-shaped cells. And so it's fair to assume that that is not a typical morphology for this patient's red cells. And so as we look around, we see that all of these red cells look the same. There's an occasional, or there's a very rare echinocyte here. Not enough in, there's not one in each field, and so those sorts of poikilocytoses are normal and are not commented on a peripheral blood morphology smear. So let's take a look at some artifacts, even on a normal peripheral smear. So first, we have an example of a poorly stained smear. Let's find our feathered edge. And you can already tell that it's a little bit more faded than the previous. So the white cells nuclei are not as pronounced, and they're not as blue, and they're kind of faded looking. And so if we move again one field into our zone of holes and another field in to our zone of morphology, we can see not only is this a poorly stained slide, but this patient might also have anemia. So you can see how far apart these red cells are spaced from one another. And so again, this is an example of a poorly stained smear. And so as we go higher power, we can see that this neutrophil here is a little bit too basophilic and it doesn't show that salmon color that we like. And there are some cells in here that it will be difficult to identify because the staining isn't optimal. And so we just want to make sure that we are getting the best specimen. And so if you run across a morphology like this, please talk to one of the special heme techs to see if they're not able to make you another properly stained peripheral blood morphology smear. So that's one example of an artifact that you can see on a peripheral blood morphology smear. Another is this example. So here we see an example of heparin contamination. And so this patient had heparin on board, and so it causes kind of a pink, what I would describe as a glow in the background of the red cells. And so you can see it here a little bit, but I'll show you some good examples. So you can see the heparin contamination shows this kind of haze around some of the red cells. And so as you could imagine, this can sort of sway your morphology a little bit, and you can get distracted by the heparin contamination, and you wouldn't necessarily have the best morphology on the red cells. So if this is the case, the specimen may have been collected in the wrong tube. But if this is a smear that you receive, you can also go ahead and talk to your special heme techs and make sure that they can get you an adequately stained blood smear. So here's just some more example of that heparin glow or heparin contamination. So that's all I'm going to talk about for peripheral blood smear morphology in a normal patient. And next we'll talk about some abnormal red cell peripheral blood morphologies.